How does cognitive reserve impact dementia test scores? Have you ever wondered how some people seem to cope better with dementia than others, even when their brain scans look similar? This phenomenon is largely due to something called cognitive reserve. Cognitive reserve refers to the brain's ability to adapt and withstand damage. It is shaped by factors like education, occupation, and engaging in mentally stimulating activities throughout life. Research shows that individuals with a higher cognitive reserve often perform better on cognitive tests, even when they have similar levels of brain damage compared to those with a lower reserve. This means that people with a strong cognitive reserve can tolerate more brain damage before they start showing clinical symptoms or impairments on tests associated with dementia. In fact, cognitive tests may not fully reflect the severity of underlying brain changes in these individuals, which can sometimes delay diagnosis. However, there is an interesting twist. Once dementia symptoms do appear in those with a high cognitive reserve, the decline in cognitive abilities tends to happen more quickly. This is because by the time clinical symptoms emerge, the disease may have progressed further in these individuals. Despite this rapid decline, their cognitive test scores often remain higher than those with lower cognitive reserve for a while. Eventually, as the disease progresses, these scores may converge. Building cognitive reserve happens over a lifetime. Engaging in education, pursuing fulfilling careers, and participating in social and leisure activities all contribute to a stronger cognitive reserve. Studies suggest that a higher cognitive reserve is linked to better baseline performance on cognitive tests and may even help delay the onset of dementia symptoms. It also affects specific cognitive abilities like memory and overall cognitive function, showing slower decline over time for those with greater reserve. In clinical practice, understanding a patient's cognitive reserve is crucial when interpreting cognitive test results for dementia diagnosis. Standard cognitive tests might not capture the full extent of brain pathology in individuals with high cognitive reserve. Therefore, clinicians take these factors into account to avoid underdiagnosis or misinterpretation of results. This highlights the importance of a comprehensive assessment that includes clinical history, biomarkers, and imaging alongside cognitive testing. In summary, cognitive reserve plays a significant role in how dementia test scores are interpreted. It can mask early cognitive deficits despite significant brain changes, leading to better initial test performance. However, once symptoms become evident, the decline can be more pronounced. Recognizing the impact of cognitive reserve helps improve the interpretation of cognitive assessments in diagnosing and monitoring dementia. Always consult healthcare professionals for personalized advice and assessments.